Face them when we do it.
Good evening, four guys. So
Hey everyone, my name is Guillermo Rosales, and I am here with Whitney Morrow and Maddie Sexton. And this is our actual teaching video. So first I want to start off by saying that we're interested in the rural community of Phelan just because of how they're out in the rural areas, and we wanted to see how they access healthcare and the troubling and barriers that they had. So we began by looking into the elderly population and how they receive proper medical attention and how it was for them to live in the rural area community. So with that being said, there was many resource barriers where people would actually not have access to Medicare or healthcare, any urgent care access out there. And there being urgent care facilities as far as like medical offices like Dr. Gill, but there's certain insurances that people have where if that health network is not taken by that medical facility, they would have to actually reach out to get further health care. So with that being said, there's actually transportation issues as well and other lack of resources that they would have. So our goal was to strengthen the community of Phelan by giving them access to information and informing them on ways that they could actually be more resourceful and actually learn other ways to access healthcare. And by providing them information from the 211sb.org website and other information such as the ambulance, I'm sorry, what is it called, guys?
Subscription program.
Ambulance subscription program, sorry about that. We're actually gonna be giving them information on this stuff, which Maddie and Whitney would talk further on. Because the statistics of the senior residents in Phelan are actually show that seniors need healthcare, and the reason why, I'm sorry guys,
You're fine. So they need.
For you and the birthday.
so the statistics that show that 90% of seniors live in Phelan, and they're living alone. So 2% of them have an annual income of less than $20,000 per year, and 4% of them receive food stamps. So with this being said, we wanted to see if we could actually save them money by actually giving them more health promotions resources. That way they actually don't need to access healthcare as often as they would, and reduce the morbidity rate.
Okay.
All right, so like Guillermo was saying, the rural city of Phelan, California has a lack of medical facilities and healthcare resources in the community, and the residents of Phelan may not have the proper medical attention that they need to treat their current health conditions. Many of the residents may not be able to get transportation to and from their doctor's appointments and may not have their own personal vehicle, and this could lead to a worsening of their conditions. And since the nearest hospital is around 20 miles away, it may be more difficult for them to get medical attention that they need. With that being said, if there was ever an emergency and one of the family members had to call 911, if their insurance doesn't cover the ride, it can cost the family up to $3,000 for a trip to the hospital, depending on what services were provided by the emergency medical staff. This is where the ambulance subscription program that Guillermo mentioned comes into play. The ambulance subscription program is a service offered by San Bernardino County Fire, and it is offered in the areas of Phelan, Hesperia, Lucerne Valley, Trona, Wrightwood, Pinion Hills, and Lake Arrowhead. So for example, if the patient is taken from Hesperia in a San Bernardino County Fire ambulance and is transported to a local hospital in Victorville, this ride would be covered. But if the patient was picked up somewhere like Victorville and was taken to another hospital, it wouldn't be covered because Victorville has a contract with AMR and not San Bernardino County Fire. So it depends on where the 911 call was placed at that time. So the price of the program is $65 per household per year, and this covers anyone living in the household. There's no limit to the number of rides per year, but this service is only available for emergency transportation and not non-emergent transport. And once subscribed to the program and it has been utilized and a 911 call has been placed and they've been transported, the member's insurance will be billed if they have any, and whatever's left over or the deductible will be covered with the service. So there's no age requirement to receive this service and no limit to the number of members per household. This could be something that's super useful and something to look into because it could save families thousands of dollars when you just spend $65. So if it fits within your budget, it can save you a decent amount of money in an emergent situation. And like Guillermo was saying, due to the lack of resources in the community of Phelan, this can cause potential problems for the residents who have comorbidities and are not able to receive the appropriate care needed. And if this problem isn't solved, it can could result in an increase in morbidity and mortality rates within the community. So does anybody have any questions about the ambulance subscription program? I have, Whitney has the handout if you guys want to look at the contract too.
You guys want to look at the contract?
Oh, for the ambulance?
Yeah.
Well, tell them my Blue Cross PPO pays for the ambulance and the helicopter or whatever.
Good.
Okay.
That's a good thing to have. Some people don't have that.
Right.
So it's just a good thing to look into. And then I'll hand it over to Whitney.
All
What's that,
right.
Guillermo?
We also wanted to ask to see if we could actually spread the word too and give more information to others that are actually in need as well.
Yeah,
Spread
just,
the word.
yeah, just spread the word of what we're like teaching you guys. So, alrighty. So as Maddie and Glimmer were talking about the different ways the community can access healthcare, there are different types of resources that you both and other individuals can look up. So do you guys have access to internet?
Sure, yes.
You guys both have, okay, you guys all have access to internet? Okay, do you guys have insurance? As you stated, you said yes.
Yes.
Okay, who's your guys' provider?
Ask the Blue Cross.
Okay, who's your provider?
Mine is Molina Healthcare.
Okay, and then how far do you guys have to travel to see your healthcare provider?
30 miles now.
Okay. So since you guys both have access to the internet, there are ways that you can incorporate your well-being. So some good resources that are good to look at is the 211sb.com, and this program helps you direct in ways to eat healthier and how to access areas that give out food if you are in need. They also teach about the importance of healthcare services that are provided by Medicare and how to support you through this time of COVID. So as we all know, COVID is very dangerous for all of us, especially for our elderly population. So that's why it's important that we try to stay healthy. And then since KR has COPD, it's important to remind you that and recommend her on like foods that can help strengthen up your immune system. And if there are any concerns about her health, you can call the number on the back of your guys' insurance card. So when you look at your insurance card, you guys can look at the back of it and it will tell you, and then call them and then it'll give you guys resources on how to find out who your main provider is. This can also help you find out who your main provider is. So when it comes to food you can eat, it can also affect your breathing because your body uses food as fuel for activity. So we must have the right nutrients and healthy diet to improve our body. So with KR, it's important to have a diet with fewer carbohydrates. You should limit carbs that are like sugar, candy, cake, or sodas. And then what you should be eating is 20 to 30 grams of fiber, such as nuts, seeds, fruits, vegetables, whole grain, pasta, or bread. And should have a good source of protein to help maintain a strong respiratory muscle. So this includes like milk, eggs, meat, fish, beans, bananas, oatmeal, and others. So you want to make sure you have unsaturated fats that are from plant-based. Vitamins are also important with people with COPD because since you take steroids, right? Okay, well, if you had took steroids with COPD, you would want to include calcium and make sure you drink a lot of water to stay hydrated and to keep your mucus thin for the easy removal. Now, DS, since you have hypertension?
No.
Oh, you don't? Oh, you had hypertension.
Live with your mother.
Okay, so when I've talked, I thought you had hypertension. I'm sorry. So, well, anyways, if you had hypertension, it's important for you to have a diet lower in sodium. So this includes whole grain fruits, vegetables, and low fat dairy, fish, and chicken. So as we know, sodium can increase pressure because it holds excessive fluid in the body and creates this burden to the heart. So this can increase a stroke, heart failure, kidney disease. And other resources for you to look are the American Heart Association and this website. It can help you access and give you more knowledge on how to live with hypertension or make your blood pressure stable. So what our goal here was to help you guys understand different types of resources that are available to you in the community. We wanted to provide you guys with information on transportation, how to access your primary care provider, and nutritional benefits. We actually really appreciate your guys' time. Do you guys have any questions or concerns for us?
No.
Okay.
Awesome. Thank you, guys.
Thank you so
Thank
much
you.
for your time.
Thank you.